Ever wondered what tonsillitis is and why it's such a common infection? Tonsillitis is an inflammation of the tonsils, two oval-shaped pads of tissue at the back of your throat. Acting as the body's first line of defense against airborne or ingested pathogens, the tonsils are rather prone to infection, hence the commonality of tonsillitis. As a condition, it doesn't discriminate. It can occur at any age, though children are particularly susceptible. Why children, you ask? Their immune systems are still developing, making them more vulnerable to viral and bacterial infections. But don't be fooled. Tonsillitis isn't a walk in the park. It can cause substantial discomfort and other health complications if left untreated. So, while many might dismiss tonsillitis as just a pesky throat infection, remember, it's a condition that can have a significant impact on our health. So, what causes this inflammation in our tonsils? Well, tonsillitis is predominantly caused by an infection, which can either be viral or bacterial. Viral infections are the most common culprits, with the Epstein-Barr virus known for causing mononucleosis, and the common cold and flu viruses leading the pack. While less frequent, bacterial infections can also instigate tonsillitis. The most common bacteria responsible is Streptococcus pyogenes, the same bug that gives us strep throat. Other bacteria, including Mycoplasma pneumonia, Chlamydia pneumonia, and Bordetella pertussis, can also play a role. It's important to remember that tonsillitis is contagious. It spreads through droplets when a person with the infection coughs or sneezes. This means that it's not just about understanding what causes tonsillitis, but also how it spreads. Keeping these causes in mind can help us prevent tonsillitis. The more aware we are, the better we can protect ourselves and others from this throaty affliction. How do we know if we or our loved ones have tonsillitis? Well, the telltale signs are hard to miss. The most common symptom is a sore throat, often severe and sudden in onset. It can feel as though you've swallowed a handful of sandpaper, and it's accompanied by difficulty swallowing. Now imagine your tonsils, those two oval-shaped pads of tissue at the back of your throat, swollen and red. This is another common symptom of tonsillitis. In some cases, the tonsils may exhibit white or yellow spots, a visual sign of the infection. Additionally, symptoms can include a high temperature, coughing, headache, feeling tired and unwell, and even a voice change due to swelling. Remember, these symptoms can vary depending on the cause of the infection, whether it's bacterial or viral. It's important to be aware of these signs, as they are the body's way of signaling that something is amiss. Recognizing these symptoms early can lead to quicker diagnosis and treatment. Did you know there are different types of tonsillitis? Yes, indeed, tonsillitis is not a one-size-fits-all illness. There are three main types: acute, chronic, and recurrent. Firstly, acute tonsillitis is the most common form, characterized by a sudden onset of symptoms that can include severe throat pain, fever, and difficulty swallowing. It typically lasts for a few days to a week. On the other hand, chronic tonsillitis is a persistent infection of the tonsils. Symptoms may be milder than acute tonsillitis, but they are long-lasting. Individuals with chronic tonsillitis may experience a sore throat, bad breath, and swollen lymph nodes in the neck on a regular basis. Lastly, recurrent tonsillitis is when a person has multiple episodes of acute tonsillitis in a year. It's like a guest that overstays its welcome, popping up just when you thought you were in the clear. Each type of tonsillitis has different symptoms and may require a different treatment approach. Knowing the type of tonsillitis helps doctors to treat it more effectively. How do doctors confirm if it's really tonsillitis? Well, the diagnosis often begins with a physical examination. Doctors will look for telltale signs such as swollen, red tonsils, and sometimes white spots or pus on the tonsils. They may also check for a fever and swollen lymph nodes in the neck, but physical examination alone isn't always enough to confirm tonsillitis. To be sure, doctors may order lab tests. A throat swab can be taken to check for bacteria. This is called a throat culture. Alternatively, a rapid strep test may be conducted. This test can detect strep bacteria in minutes by analyzing the proteins present in the throat. In some cases, especially in children, a complete blood count, or CBC, may be done to rule out other conditions that may mimic tonsillitis. Remember, the symptoms of tonsillitis can be similar to other medical conditions. So, a thorough and accurate diagnosis is crucial to ensure the right treatment. What can we do if we or our loved ones have tonsillitis? When it comes to treating tonsillitis, there's no one-size-fits-all approach. The treatment methods hinge on the cause and severity of the infection. First and foremost, rest is crucial. The body needs energy to fight off an infection, and getting plenty of sleep, can help speed up the recovery process. Hydration is also key in treating tonsillitis. Drinking lots of fluids can soothe the sore throat and replace the fluids lost due to fever and sweating. If the tonsillitis is bacterial in nature, antibiotics may be prescribed. These drugs are effective in killing bacteria and can help alleviate symptoms within a few days. It's important to finish the entire course of antibiotics even if you start to feel better. Not doing so can lead to a recurrence of the infection and potentially antibiotic resistance. In more severe cases, or if tonsillitis is a recurring issue, a tonsillectomy may be recommended. This is a surgical procedure that involves the removal of the tonsils. While it may sound daunting, it's a relatively common procedure, and it can be a long-term solution for those who suffer from chronic tonsillitis. However, surgery is usually a last resort. Doctors will consider factors such as the frequency, duration, and severity of the episodes, as well as the impact on a person's daily life before recommending a tonsillectomy. It's essential to remember that every individual is unique, and what works for one may not work for another. Treatment should be tailored to the individual's needs, taking into account their overall health, the severity of the tonsillitis, and their personal response to medication. In summary, the treatment of tonsillitis can range from simple rest and hydration to antibiotics and even surgery, depending on the severity and cause of the infection. Remember, the treatment depends on the cause and severity of the tonsillitis. Are there ways to manage tonsillitis symptoms at home? Absolutely. There are a few home remedies that can provide some relief. Drinking warm fluids like herbal teas or broths can soothe a sore throat, and they also keep you hydrated, which is crucial in fighting off infections. On the other hand, cold foods like ice cream or popsicles can help numb the throat, providing temporary relief from pain and discomfort. Throat lozenges or hard candies can also be beneficial. They stimulate saliva production, which can help keep your throat moist and alleviate some of the dryness and irritation. Additionally, a warm saltwater gargle can help reduce swelling and discomfort. Remember, these remedies can help manage symptoms, but they're not a cure. They should be used in conjunction with, not instead of, prescribed medical treatments. If your symptoms persist or worsen, it's crucial to seek medical advice. While these home remedies can help, it's important to seek medical advice if symptoms persist.